Thousands of Bay Area students are back in the classroom as the COVID-19 surge continues to pose challenges and some concerns. Joining us now is the Chair of Public Health at Cal State East Bay, Dr. Arnab Mukherjea. Thank you so much for joining us.
Thank you for having me.
First, do you think it's safe for students to be returning to the classrooms, especially since the Omicron variant is so contagious?
Well, that's a tough question right now. Obviously, what we do know is that the Omicron variant is much more contagious. We also have to take into account that the course of disease is much more mild than previous variants. That being said, as an educator and as the parent of two children, I look at every situation as a risk-reward benefit. Yes, sending people into in-person instruction carries a risk, particularly with the contagious variant. On the other hand, we have to learn our lessons from what the consequences were of having students stay home for a prolonged period of time, not only for their learning purposes, but their mental health and their socialization. So I don't have an easy answer for you, but all of us have to really look at the costs and the benefits of any decisions that we make.
Yeah, certainly a complex issue. Now, if students have traveled recently, do you suggest they should be staying home for now?
So my thought is that if you've traveled recently for the holiday season, the first thing you can do, and actually the absolute first thing I hope everyone is vaccinated and if eligible, boosted. That being said, if students all the way from K through 12 and including the place where I teach, I would strongly recommend that people take a rapid at-home test, or more ideally, they take a test if it's offered by their institution, like it is at Cal State East Bay. Presuming the test is negative, I think that we have the safest possible opportunity to return to in-person instruction.
And lots of parents and students are dealing with the anxiety of going back to school. What is your advice to them?
You know, this is not March 2020. We have a lot more tools at our disposal. We know that vaccines work for those that are eligible. We know that boosters in particular pose a great level of protection. That being said, some of the most basic non-pharmaceutical interventions that we know that can cut down on transmission is a high quality mask. So I think it's safe to say that although cloth masks are better than nothing, as a parent myself, I have my children wearing KN95s. They're easily available, and I would urge all people to basically use the tool that we have at our disposal. And just to know that, God forbid, if an infection should occur, we're in a place that will not result in a high likelihood of the most unfortunate outcomes right now.
And what are the testing policies at Cal State East Bay, and how can students get tested on campus?
So right now we offer testing. We are in the winter recess right now, so testing is available, I believe, 2 days a week. Once school starts again, it will be available 5 days a week. And so I strongly urge faculty, staff, and students to take advantage of that. As far as the K through 12 school districts, it really depends on where you live. I know that in Contra Costa County, for instance, most of the school districts are offering PCR testing at either the district site and in more rare cases at the schools themselves.
And the test positivity rate keeps climbing here in California. When do you think things will start to level off?
Oh, that's the million-dollar question. So I base my judgment on what's happening in other parts of the world. It looks like in South Africa, of course, a different population, but it looks like the peak crested in about a month, and then it's come down very quickly. So in about a 2-month span from Thanksgiving, they are close to where they are pre-Omicron. The UK seems to indicate that they have crested. So I am, again, making only an educated guess, but I venture to guess that the peak of the Omicron curve, especially in vaccinated places like the Bay Area, will likely happen sometime in the next 2 to 4 weeks, and hopefully a rapid decrease soon thereafter.
All right, Dr. Arnab Mukherjea with Cal State East Bay, thank you so much. We appreciate your time.
Thank you for having me again.